You are listening to the Your Knee, Your Health podcast. I'm your host, Adam Rosen. I'm a fellowship-trained, board-certified orthopedic surgeon who specializes in knee replacement. Here I'll talk to you about common knee complaints and other orthopedic issues. We'll cover other important health-related topics, all of which are meant to helpfully answer some of your questions and help improve the quality of your life. Thanks for listening, and on with the next episode. Hello, welcome back. This is Adam Rosen. You're listening to the Your Knee, Your Health podcast. So this is episode 90, and just some show notes stuff too. If you don't also know, I do have a YouTube channel, and I'm covering similar topics and some different topics. This is one that I have recently released on YouTube, but I also wanted to cover it for some of the podcast listeners because I think it has some very important content and information. And again, if you're not already aware, I do have a new book out titled The Knee Book, A Guide to the Aging Knee. So for any of you suffering from knee pain, wondering what exercises to do, medications to take, should you have knee replacement surgery, what is knee replacement surgery, what's the rehab risks, complications, and expectations like, this book answers all of that. But for today's episode, I'm going to tell you why your knee is like and not like your back. And this was on the forefront of my mind recently because I was dealing with some back issues. Also, you've heard me talk about back pain. It's one of the leading causes of missed days at work. And although I didn't miss any days of work, I had some miserable days and nights when I was having this back pain and this radicular pain. And, unfortunately, now confirmation with x-rays and MRI, I do have a bad back. So I'm going to continue with my exercises. But that's where, backs and knees are similar and different. So, I tell patients, when they come to see me and they basically walk in the door with the idea of, hey, I have knee pain, I want a knee replacement. I'm like, whoa, time out there. Let's take a step back. And sometimes their thought process is, well, I have a friend who had knee pain and they had a knee replacement and they're doing great. And that may be true, but you don't know how bad was your friend's knee? How bad was their arthritis? How bad was their pain? What other things have they tried first? Because I'll stop patients and say, have you known anybody with back pain? And they say, yes. And I say, and did they come to the surgeon and request back surgery? And most commonly, the answer is no. What did they do first? Well, they did exercise. And most people are aware that when you have back pain, we want to strengthen your core. This is your back muscles and your stomach muscles. These are the muscles that solidify your core and strengthen the muscles that surround the spine and those joints and nerves within it. Because a lot of times, if you strengthen those core muscles, it may lessen and sometimes get rid of completely your back pain. And if the medicine or if the exercises are not enough, sometimes you'll add in some medications like anti-inflammatories. Sometimes you may have injections like epidural steroid injections, and all of that first before you then rush into back surgery. So the same thought process should come with your knee, that if you have knee pain, I don't recommend walking into an office and saying, my knee hurts, I want a knee replacement. First, you have to ask yourself, have you tried these simple things? So when we talk about the muscles in front of your thigh, the quad, and behind the hamstring, these are your core muscles of the knee. There are some other muscles also. Your gastrocsoleus, which is your calf muscle below the knee. But you may have also heard me talk about on a previous episode the importance of the hip muscles, the gluteus medius and minimus, because when they're weak, it can cause issues with the knee as well. So we want to strengthen these core muscles of the leg, and you can do this on your own, or you can do it with a physical therapist, or maybe start on your own, and if you plateau, then see a therapist. But strengthening those core muscles is number one. And it's amazing how many people I see with severe arthritis on x-ray with very minimal symptoms. And these usually hikers or tennis players, bikers, because I find those three groups of people tend to have the strongest muscle. So although they have arthritis, their symptoms are quite minimal. Now, if the exercise is enough or are not enough and you still have symptoms, again, then you may consider trying medications and maybe we don't do epidural injections in the knee. We do cortisone injections in the knee. So for people that fail exercise and fail pills, they may try injections. And after all of that, then consider knee replacement surgery. So it's just a thought process that I like my patients to understand. And I think, it does make sense once they think about it that way, as opposed to just rushing in with knee pain and jumping right into knee replacement surgery. Now, that is how the knee is like a back. Now, how is knee not like a back? Or specifically, how is knee surgery not like back surgery? And I've had this discussion with a number of patients that have had prior back operations, because when I talk about the rehabilitation after knee replacement surgery, they're quite surprised that it's totally different from their back surgery rehabilitation or lack thereof in the beginning. Because if they went and had a fusion, they had bad arthritis in their back, and someone did back surgery, they put cages and rods and plates and bone graft of some sort in their back. The idea was to go home. Sometimes, depending on where it was done, they might actually need a brace, but it was to go home and rest and allow the back to fuse. You want those bones to knit. You want that to become solid. You do not want any motion, which is completely opposite from knee replacement. So if you have back surgery and you had a fusion and you go home and you lay on the sofa and you rest, the bones knit, they heal, they fuse, they become solid. That's the goal. If you have a knee replacement and you go home and you sit and you do not move, the knee replacement will solidify. We typically call that arthrofibrosis, but essentially you develop scar tissue and your knee will be stiff. That is not the goal. And those people will have pain. So when you have a knee replacement, you have to understand that even though it was surgery and orthopedic surgery, the rehab is completely different from a back operation. With a knee replacement, we want you to go home and we want you to get up and we want you to walk and we want you to move and bend and straighten your knee to gain motion. We do not want to lose motion, and we do not want the knee to be stiff, because if it's stiff, it's going to be painful and it's going to be problematic. So back surgery for fusions, you may go home and rest and limit your motion and mobility to let that joint or joints fuse, or the disc spaces fuse. Whereas when you have a knee replacement, the top bone, the thigh bone, and the bottom bone, the shin bone, are supposed to move around one another, and you do not want those two things to fuse or become solid, because then your knee will not bend. So they're just kind of my 2 cents on the back and how the knee is like the back as far as the importance of core exercises, medications, and possibly injections before you rush into surgery, and how it's not like back surgery where you need to move your knee and do appropriate rehab to get good range of motion in your knee after knee replacement surgery, as opposed to getting it to be stiff and sticky and arthrofibrotic, which would be more analogous to a fusion in your back. So again, thanks for listening. If you haven't already, please subscribe, leave a review. It helps other people like you find this podcast. And until next time, I'm Adam Rosen. You've been listening to Your Knee, Your Health. Stay safe. Thanks for listening to the Your Knee, Your Health podcast. If you've not already done so, please subscribe so you'll be notified of future episodes. And if you enjoy what you're hearing, please take the time to leave a review. It helps other people like you find the show. I'm your host, Adam Rosen, and until next time, stay safe.